It also gives me the opportunity to welcome you to the ISN conference one day earlier. Tomorrow we'll have the formal opening. And I'm happy that you're here one day earlier and taking part in this. So coming to today's program, now I always felt that in a conference, there are two kinds of learning. The first, the main learning is in the classroom, is in the hall, where you're kind of bombarded with the academics, the guidelines, the studies and graphs, and eventually it's a horizon of decimal points. Along with this, where the main academics is going on, you also learn on the sidelines. And what you learn on the sidelines, outside while having coffee, or maybe a drink, or in the breakfast table with your peers, that learning is also equally important. So what the science that you learn in the classroom, and you're not sure how to really implement that science, and you get the practical tidbits from the other side discussions. So I think Umesh has perhaps struck gold yet again, and although he calls his conference the Hatke conference, but I think you have struck gold again. There is enough opportunity to build this side of it. Right. So congratulations once again. So now we have the panel. I think Dr. Vijay Kher's talk and also Umesh's introduction and his life story provides just the right backdrop for this panel discussion. And I have in the panel with me Dr. Sachin, who works in the private sector at Aurangabad, which is a second-tier city, and he will tell you about the problems in Aurangabad. Dr. Varun, who is in a private medical college, but he also worked in the private sector before shifting over to that, so he has a unique double perspective. Orpita and Dr. Yadla, they are in the government hospitals and in hardcore academics. So they will give you the perspective of the government hospital. Also Dr. Shri Bhushan Raju. And the ladies will give a unique sort of insight into the problems for a lady nephrologist. So let me begin with the government sector. So I think Shri Bhushan, I will start with you. What are your main challenges today?
So good afternoon, everyone. And I were to borrow one sentence from Dr. Vijay Kher's talk that the government medical colleges and the hospitals, the practitioner will have a little bit more time. And because of that only, in fact, I chose this government teaching institution. Not because I just wanted to have a leisure time or something like that. My ambition since my childhood was actually to become a poet, writer, singer, and an actor. So I thought I would become one day, so that in the evening hours, after that evening hospital hours are over, then I thought I will go and learn Carnatic music, and I'll try my best in acting and all other thing actually, and also to learn Sanskrit also, so that I can pursue my literary skills over a period of time. But actually, it took only few weeks and few months only for me to realize that that's not the true actually, that truth that I can really pursue my career in academic institution just like that casually till from around 8 o'clock to 4 o'clock, and just wind up and go back and home and start learning music and all that thing.
Okay.
So then within few months I realized that it is a tough time in a teaching institution, and where there's no private practice and the salaries were meager, and I had a lot of opportunities outside, and people were actually running behind me. They were influencing my parents, influenced my brothers, sisters, and my cousins, and including our own Nizam's Institute of Medical Sciences director also, the then director Professor Kakal Subbarao, and people were influencing him also that so that I can come out of this institute. And I decided since my childhood, in fact I should tell you one word only about my childhood, that I belong to an area where the hardcore communists were there. And I had, though my backdrop at home was actually predominantly RSS based, but outside it was more communist based. All my teachers were communists. And I had some kind of a thing very unusual that I never wanted a private practice actually, to be very frank. I don't know. So right from since my childhood, I disliked it because I was going to nearby hospitals here and there with my parents on and off, and we were paying some money also, and I found it very unusual and like a bit uncomfortable to me. So then I decided in my childhood only that if at all I become a doctor, then I will not go for such a practice. But that luckily I got into medical college and then into Nizam's Institute for my MD, then DM Nephrology from All India Institute of Medical Sciences. One day Dr. Chaku Jacob came as an examiner, excellent examiner for my senior Dr. Raj Sri Ram Setu. I went to the airport to pick him up, and while traveling back he was asking me, what is your next to a teaching institution. Anyway, he got confused actually. I never heard any youngster saying that will go back to teaching institution, but do you have any job? Yes, sir, I go back to Nizam's Institute of Medical Sciences and I pursue my career there only. And he said, it's very unusual that the people are opting for corporate sector. And how come you are interested more in a teaching institution? Then I thought I will be more better suitable because of my nature, my attitude, and my background, and my brought up, and so many reasons. I probably would be more. But in fact, teaching institutions, as people know that it has got its own. This is briefly about why I chose a teaching institution rather than anything else. And medical colleges were also there, Uthmania and Gandhi Medical College. But actually, I know that there is a private practice allowed there also, but which is again against my nature that I never wanted to go out for private practice, rather stick to one place and continue my career there only, and more like a teaching institution. One day, one senior big personality of a corporate hospital came to our director room, and our director called me, and when I entered into the room, my director asked me, Bhushan, tell me, what is your... Then without an hesitation, I said, to become one of the best nephrology teachers in the country. Then he looked at the senior person, said, see, that is the ambition. How can I pursue him? How can I pressurize him to leave this institute and go for a private practice? So that was actually the thing. And I decided long back that I never wanted. Even now, definitely, especially government institutions,
aims. So I had to compromise on research at that extent, but at least she allowed me to stay in a private medical college, so both of us are good now, and so I can go ahead with my teaching and to some extent academics. Some research is done since a private medical college and a new unit. I had to start the unit by myself. Most of the times I'm the only decision maker, so I cannot move on the conferences because I have to. Someone is responsible, has to be there. And the second thing which I always wanted was academic conference. I wanted to be among our stalwarts which are here. Many of them whom we did not know couple of years back. I was just working and I was studying, so I didn't know all these stalwarts. So I wanted to be among the conferences, have an opportunity to interact with them like a mentor, to know what they do, how to do research. This opportunity was not that. That is what I am telling now. That is what made me to push beyond. So I just started interacting with whichever person I went. Any opportunity I get, suppose when Umesh Khanna sir asked me that we need some volunteers, no hesitation, you do it. Some other person, some other team comes and asks me, can you do this for nephrology? I do it. You never hesitate. See, you're compromised on one extent, so you have to push yourself at the other end. Otherwise, it's not going to come out. So, like this, the same thing with international societies. Once you go to ISNs, any meeting happening in ISN, the sidelines, go in. I just barge in. I ask the moderator there, can I attend the meeting? It's not the conference. I'm talking about the executive meetings. So, like that, now I become part of the CKDU committee. I become part of the Advanced Clinical Trials committee. I just go in, barge, and ask, ma'am, I'm interested, can I join? I'm not a part of member. There's no one who's going to say no. That is one fear which I had. As students, I know most of you have that, what with the senior, how can I go and ask them, how can I approach them? I approach most of them and none of them are like, so selfish. They are ready to teach. So just come out of your inhibitions.
Thank you. So far what is evolving is that basically everyone is following their passion, and they may be different actually. Somebody likes to teach, somebody into practice. Now, a very pointed question to you. After making the shift, do you have any regrets? And in future, do you think there's a possibility for you to switch back? That's easy, isn't it?
I had for a couple of months when I decided I'm going to shut down that I'm not going to look at my colleagues. Someone comes in a BMW, let him come. I'm happy having in my own Hyundai Datta. So once I stop that, I think there's no regret.
I think let's move to Dr. Sachin. Dr. Sachin is from Aurangabad. He works in a private hospital, and he has built a lot of things in that area, away from a big city, and it's quite challenging. We will hear about what you did. Yeah.
Yes.
And what you faced right now. I mean, importantly, what is your main challenge now in there?
So, as I said, I belong to a place called Aurangabad, which is part of Maharashtra. Sub-region is Marathwada. So I was kind of fifth nephrologist going there. The challenges are at multiple levels. In general, there are challenges for all nephrologists, that there is a primarily refusal of patients to accept the proper care. That is the biggest challenge we all nephrologists face all the time. First of all, let me tell you, like from day one of my practice, I am working in a private sector. I have never worked in a teaching institute. I have some kind of attachments to teaching institute, but throughout my entire career is in a private hospital. But there are many role models of doing good private practice. I think Bharat Shah sir is there. Sir has migrated from teaching hospital to private hospital. Umesh Khanna sir is there. Urmila madam is there. Shruti, Rajesh, like all these people are doing good private practice. At the same time, they have some kind of academic prominence. They may not be in medical college. So probably it is incorrect to presume that you cannot do academic work if you are in private. Of course, that extent of academic work will go down. For example, when I started my practice, I had kind of 40 publications in 2010, and now, in 14 years, I have not even reached 50. So that is the problem when you get into private practice, because you become a part of that kind of rat race. I have a problem related to the place I work, like I shared with sir, we don't have like local level lymphocyte cross match, DSA or drug testing, so we have to rely on outsourcing. That can sometimes become a challenge, especially in cadaver transplant program. Then when people are in proximity of bigger centers, like a patient of Aurangabad may like to go to Pune, that is another problem you face, that you feel that you are doing a good work, good scientific, correct work, but still patient would prefer to go to higher center. That is another problem. But I am seeing many students here, over the period of time, going to periphery will be your destiny, because all bigger centers are getting populated. And there is no harm in it. You can do, you can develop yourself. You need to choose your area also. Like over the period of time, already there are specialists like interventionalists, transplant and dialysis persons. Over the period of time that will happen. You need to identify your strength and project in at least one strength of yours, along with practicing entire nephrology. And I know that Mike is not going to come back to me again. So a small piece of advice to all my young friends, that please identify, please understand that your patient is your property. So please remain honest and ethical with your patient. Everything you will get. Everything you will get.
Yeah.
Yeah. Don't get your, indirectly I want to tell that don't let your prescription be driven by industry.
Exactly.
If you are honest with patient,
point.
if you have patient bank, everything you will get. You will get money, you will get pharma, you will get everything. You will get other hospitals demanding you, existing hospital want to retain you. So be honest and ethical to the patient.
Thank you for bringing up that very important point. So at this point, before I go to the seniors for the sum up, let's invite the questions from the floor. Yes.
Only one thing you didn't ask me, what I didn't.
Dislike.
So
your dislike
my mind.
my
Dislike is you tend to read less when you are in private practice. Only time you are reading is probably when you are preparing a lecture. Over the period of time, your precision in talk goes away. And then if somebody asks you a question, you say, in my experience. Once you say, in my experience, you are finished academically.
Correct. Good point. Good point again. But you know, sometimes you can give a very practical advice. That is also true. That's also
I
true.
think questions from
Questions,
the back, please.
Questions.
Come on, this is for you.
I think, Umesh, you should have had a longer time for this. This is a very interesting
so actually all
session.
topics are very interesting. That's
Very
the problem.
Correct.
And
Okay.
I was hoping they will come up with questions. So one of the ways to combine the two, money, academics.
So I'm just coming to Dr. Vijay Kher next, actually. Dr. Kher has perhaps had a dream run, so to say, because he's from one of the best institutes at this time. Happens to be my institute as well. Then he went abroad, got the finishing, you can say. He came back and he joined our government hospital, which was just coming up at that time and leading a pole position in the country. He left that and joined the private sector. Now he is into entrepreneurship. So probably all 5 facets he's had serially. So that's a very unusual thing. And just one line. Bharat, more or less the same. More or less the same. So we will just have your...
I have already said what I needed to say. I think what Sachin said is very important, is that keep yourself ethical. I think when I joined from Sanjay Gandhi Postgraduate Institute to Delhi, I was told that you will have to pay commission. That's the only way you can develop practice. And the Maulana Azad people, and there are Maulana Azadians here, they are a group. They will not let you grow in this Delhi. And I can tell you both of these are wrong. Both proved to be wrong. Within 10 years, see, I came to Delhi, I wasn't from Delhi at all. My practice developed in that area. And in 10 years' time, at Apollo Hospital, I was the leading practitioner of nephrology in that city. Without paying any commission, I can see into everybody's eye. Whoever's going to say.
Yes,
I can see
absolutely possible.
into the mirror itself that I didn't pay and didn't take even a single penny. But despite that, my practice, and Maulana Azad were as good fellows to me as well as they were to the other fellows as well. And there wasn't anything. So I think you have to remain ethical. You have, don't look at any patient. If you follow patient's concerns, you're going to be the doctor for it. Money will come to you. Let me tell you, don't look at the money. I'm telling you, be in the government, be in the private, money will come to you. And I'm sure you've been in practice and Bharat has been in practice for many years.
Bharat, anything to add? Your
Bharat has been quiet.
Your perspective.
I
have nothing more to add. I think Sachin made wonderful points. I would like to echo that. Vijay went to Cincinnati and I just followed him, and I continue to follow him. I went to private hospital, and we all practiced straightforward medicine. And if you practice very passionately, everything automatically follows. We were lucky possibly to have teachers who taught us this. It's not only your subject, but how to be a good individual and how to be passionate about your practice and be involved in good care of your patients. Both here as well as in Cincinnati, where we got trained, we had very good attending doctors. I think that influenced us a lot into practicing good medicine.
So,
The other point I would want to make is about the teaching. That see, when I left Sanjay Gandhi Postgraduate Institute, and it does bear that you had a sudden fall as far as teaching, because the quality of students determine actually how good teachers you can be, basically, because they are the ones who ask questions and they are the ones who make you up. But I think two things helped me. One, what he was saying here, that in practice you become every day. I made it a point to read for 1 or 2 hours every day. I can tell you, it is true that during the preparation for lectures and all, and I picked up topics which would make me read new topics. I was wanting to read tolerance and other things in practice, and that is what keeps you going. And I think that can be done in practice. It is not that it cannot be done in practice. So it can be done in practice as well. So I think the nephrology forum that I did was again whole 15 days of night and day research, because you couldn't have others written.
Right.
So we have already cancelled the tea break because we are already 10-15 minutes beyond that. I don't want to intrude onto the dinner time. So I think we would want to summarize.
Yeah, one line. One line.
Sure.
One.
And Kolkata.
Yes,
Yeah.
yes. I take the advantage that I didn't touch up the work-life balance for ladies. That is better in government sector. The work-life balance is definitely better in government sector. And in government sector, being in teaching position, you keep on what sir was saying, your aim is higher and higher. You need to diversify. We didn't have an interventional nephrology 3 years back. I felt that we should have. I could make it that interventional nephrology is working. Disease donors started from 2017. So these are the new challenges that are exciting, and senior teachers are willing to get more dedicated people.
Right.
with that.
Thank you. So I will like to go into the teaching sector, and how many would like to? Teaching sector. Okay.
If both choices are given to you
Give it to
today,
you.
you have a job in private and a job in government. Which one would you choose? Government, hands up.
Oh, that's quite a lot. But they're
There
already
will
in
be
the
some
government
fence
sector.
sitters. So let me ask the private. How many would want to go to private?
So there are more, because obviously they're already working there. So
Yeah,
there are no new people.
let me remind you that the gap between earnings in private and government is gradually narrowing.
Decreasing now,
So
yeah.
keep that in mind.
Yeah. So I think that finally, Umesh mentioned the term ikigai. Ikigai is the purpose of being. So I think what is really coming out of this is finding your passion, doing what you really like best, which is different for different people. Even amongst the nephrologists, you find a difference. There are somebody wants teaching, somebody needs practice, somebody needs freedom. So there are so many things. So there are 4 components, as they say in the ikigai. Firstly, you must be good for that. Like if you are not good for it, then it's not going to happen. You must have a passion. There must be some money. Unless if there is no money, then it's not going to work. And finally, it must be useful for the society. So the gap area, what he kind of saw. So I wish all of you find your ikigai. Thank you.